Well, now we're going to talk about a issue that really kind of is open for discussion year-round, but in particular, I think in the holidays, we all kind of maybe overindulge, overeat, and if you're doing that throughout your lifetime, next thing you know, you are battling a huge weight issue, and it's something that we've seen increasingly become a problem here in the Hoosier State. And joining me now to talk a little bit more about that is Dr. Jones and Gina. And you ladies are talking about bariatric surgery, but the fact is it's not just a surgery. We're talking a whole lifestyle change.
Exactly. Andy, the statistics around obesity are staggering.
Mm-hmm.
At one point, I think, as Hoosiers, we were the largest state, no pun intended.
Yeah.
But in 2009, the last results looking at the number of overweight people, there was not a single state in our country that didn't have at least 75% overweight.
Wow.
75%.
That's huge. Well, yeah, 75%.
It is. And, you know, people say, what the heck, how can we do this?
Right.
As Americans, I think there are so many cultural, society, genetic, and medical factors, but if you really think about it, we're a grazing and snacking society.
Oh, yeah.
That's a football field length, and there's some really interesting things we're learning now about the mental, the psychological part, and how it lights up an area of the brain when we eat a certain thing, just like gambling, just like food shopping. Oh, absolutely.
Nope.
And there are different triggers for different people. So the old calories in, calories out is a very minor foundation. We're also learning that it's not just the calories, it's the type of calories. The sugar calories are much worse, believe it or not, than the fat calories. For 30 years, low-fat dieting, the curve just kept going up.
That's what people thought. They thought, well, if I eat less fat, I won't put on as much fat.
But there's so much more science to it, and that's why 97% of the diets historically that we've all tried have failed. 3% success rate means scientifically we had to have something wrong.
Something wasn't working.
Yeah.
That's right. That's right. And you work for the Bariatric Center with Community Hospital.
Yes. And with the Community Bariatric Center of Excellence.
Okay. And you brought Gina along with you today. And Gina, you actually went through and had the surgery, bariatric surgery.
Yes, I did.
Give me an idea of what that was like. I can't imagine. It had to be a big surgery and a lot of life changes.
Yes, it was. It's a life change, not a diet plan. I started out right before my surgery. I was 196, and I'm down now 98 pounds since February of this year. But it's more, you know, I had to go through the program, have the supportive community, everybody there that works in the Bariatrics Center, and just being committed to it and knowing that, you know, if I'm going to make this change, I'm going to make sure I do it right. It's a chance at a new life, and that's how I looked at it. And, you know, I was diabetic before, and now I'm not on medication. A month out after my surgery in March, I was off my medicine.
So you've lost 98 pounds. Essentially another person. Small person, but it could be another person.
Yes.
Oh my gosh. And so how do you feel right now about it?
I feel great. I don't have, you know, I'm a groomer, dog groomer.
Oh, really?
PetSmart.
Oh my gosh.
So
get Gatsby over to you.
So I had a lot, with being overweight, I had a lot of like body aches at night, you know, and trying to sleep and having leg pains, and I do not have any of that now.
Wow.
And it's great. It's great to come home, not have any pain, not just fall in the chair and just want to sit there all day. So I, you know, a lot of energy. You know, I have a weight room. You know, I've invested in a weight room, and I'm able to do it all on my own. You know, with the support of my family and my friends and community. You know, everybody
Dr.
there.
Jones, would you say she's a perfect example of the sort of success that you can have?
Absolutely, and I don't look at it as the surgery. I look at it as a weight loss program, and the surgery really is a tool, just like a paintbrush and a bucket of paint, and if you use the tool properly, you get the results. The surgery helps people to realize the weight loss that has been so difficult before. So it's like the ski slope where you're on the top and you start going, and until you start to feel what Gina feels, you almost don't have the courage, the will to keep going, to make sometimes very difficult changes in your life, with your work, your family, your structure. But there's a really almost cliche saying that I think Gina will agree with, that nothing tastes as good as thin feels. To feel good, it really does make people younger, because the weight kind of drags you down and ages you, and that's what the premature mortality is from. Aging the body, the cardiovascular effects, and really dragging things down to the point that you don't even have the energy to try to get healthy. And so the surgery is not a magic tool. It's a way to help you kind of get back in control of that as you learn how to eat again and put those things back into place that need to be for you to stay healthy and hopefully to influence those around you to not bring the chips home and to be healthy.
You're like,
too.
No,
Because
don't do it.
No
Well,
chips.
You probably found that people around you now are probably a little bit healthier. Just because you've had to really embrace this healthy lifestyle to get the results that you've obviously gotten. So
yes, and you know, the support of my husband and my kids, and knowing that we all do it together.
Right.
And it's, you know, my husband, my kids are healthier. They know that they're not going to have all the junk
That's right,
at home
because Mama's
anymore.
not buying it.
And so we just don't do it. Our biggest thing is we stopped eating out.
That's right.
Stopped eating out
what you have to do.
totally.
Well, it was an absolute pleasure meeting you, ladies. Unfortunately, we're out of time, but great job with keeping that momentum going. So, you know, you look fabulous.
Thank you. I
And
feel
you just, you know, glow from the inside out, I can tell. So thank you so much. Dr. Jones,
My
absolute pleasure. We're going to put a link
much.
to IndyStyle.tv with the Community Health Network.
Thank you so much.
All right.
Thank you.
Stick around, because we come back, we've got a little more Indy Style for you. We're going to throw in the dash to Tracy Forner. Stick around.